Okay, so I am about to hang a Piggyback IV line, IV infusion for a patient. So the first thing I'm going to do is take my order from the doctor, go gather my supplies. While I'm doing that, I'm going to assess the patient's allergies, history of allergies. I'm going to check their medication 3 times. I'll perform my 3 checks while I'm getting it out, and I'll also perform the 8 writes for the medication. So it's the right patient, Allison Alvarez, date of birth, medical record match, right medication, it'll be Pepsid, 20 milligrams, right dose, 20 milligrams, the right route is IV Piggyback. The time is now 12:30, doctor's order is here, and the right reason. So I have done my 3 checks, my 8 writes, I'm ready to go. Take my supplies, come in to the patient's room, perform hand hygiene. I will introduce myself, I will check the patient's wristband and verify that the patient is correct. And then I will do an assessment. Pre-procedure, the vital signs are temperature of 97.8, blood pressure of 116/66, pulse of 78, respirations of 18. Those are all within normal limits, that's good. I'll assess the IV, the primary IV that's running, make sure that it's running, check the tubing. I'll check the site of in the hand where the IV is inserted. The skin is warm and dry. There's no erythema, no edema, and the patient is denying any pain, so that's good. So I'm all set to go ahead and put this in. I'm checking the expiration date. It's March 2014, so that's all set also.
But I'm also going to figure out the finger rate.
I lowered my primary bag down because I'm putting up the putting the piggyback on. So I've lowered this down. I'm going to hang the piggyback. I would inject the medication and add this label saying what I injected and how much, but that's actually already done, so that's all set. I also verified the medication can be mixed in with the IV solution, so that was also all set. So I lowered my primary bag, and I'm going to stick this one up here.
Okay, so I am going to get all this out.
Now I'm going to spike the bag and make sure my clamp is closed. Spike the bag. Now I prime the tubing by compressing the drip chamber, filling it to 1/3 to half full.
Make sure there's no kinks in the tubing.
And I will release the roller clamp a bit to fill the tube, the line up with the fluid. Okay, that's all set. Now I have to attach the connector, so I can connect the medication in the piggyback bag to the primary line.
And so I'm going to pull this down and pull this new thing off, and also being careful not to touch the end of anything so that it's sterile.
Here. I'm going to clean the port on this primary line here with alcohol. Attach this. When I was gathering my supplies and doing all of my pre-procedure work, I figured the flow rate, it's a 100 milliliter IV bag, and the drug book said to infuse over 15 to 30 minutes. So I'm going to go with 30 minutes, which if you do the calculation, that means it would be 200 milliliters per hour, so that's the flow rate. And I also calculated out the drop factor, and it's 33 drops per minute, so I have that information all set. So now I'm going to set the rate. The piggyback rate is 200.
I have a trash can down here, so I'll make it.
The volume to be infused is 100. So now I'm going to make sure that it's running. I can verify the drop rate. The drops per minute is 33 by just watching the drops and counting on my watch for 1 minute. Okay, so I'm just making sure that everything's running still. The patient's doing well. They're not reporting any sort of pain. So I would throw out my supplies, wash my hands again, and assess, as I said, to make sure the patient's not having any kind of reaction to the medication. Post-procedure, I will also reassess vital signs. Temperature is 97.8, blood pressure was 118/68, pulse 76, respiration is 18. All of those are in the normal range, that's good. The site of the IV insertion, skin's warm and dry, no erythema, no edema, and patient is denying pain, so that completes my skill.